name is Reese Terrio. I'm a instructor of sales and entrepreneurship here at UL Lafayette, and I'm from St. Martinville, so I'm a native Cajun. And if anybody's from, those of you who are from here know that Cajuns like to talk with their hands. So Matt has literally just taken half of my mojo away with this microphone. So I'd like to welcome everyone to Cajun Code Fest 6.0, the Opioid Challenge. So I know you guys been awake all night, so I know you guys are tired, so I'm going to try to clap as much as possible. So let's give it up for Cajun Code Fest and the Opioid Challenge. So like Matt said, I'm a full stack double ninja blockchain developer. Been doing that for about a day and a half now. So I've been coding for a very long time. No, I teach in the B school, so I'm your master of ceremonies today, and as I mentioned before, it's a great honor to be here with you today and facilitating this event. This event is hosted by CBIT, the Center of Business and Information Technologies here at UL Lafayette, home of the Raging Cajuns. So let's give it up for the Raging Cajuns. So this year's Cajun Code Fest is powered by our friends, and I want to mention every single sponsor. If I don't mention you, please interrupt me and raise your hand, and I'll be sure to thank you for your kind donation and support. Lafayette General Health, CGI, LHC Group, Oceans Hospital, Oak Ridge Associated Universities, Opportunity Machine, One Acadiana, Acadian Companies, Blue Cross Blue Shield, the Louisiana Department of Health, U.S. Health and Human Services, the U.S. Department of Agriculture and Rural Development, Socrata, Simply Vital Health, Acadiana Open Channel, golfballs.com, Bayou Tesh Brewing, and many others for supporting us. So let's give us, and Waiter. Sorry, thank you, Matt. And Waiter. How dare you forget Waiter, Reese? Come on. I also want to recognize those individuals at CBIT who have worked tirelessly at hosting an event as well as they've done today. And they've also hosted the Opioid Summit yesterday, and if anybody attended yesterday, it was a phenomenal event. I want to mention a few names. Matt Delcom, Miss Sally Johnson, Henry Chu, Andrea Fry, Jessica Manafi, Tatum Broussard. I want to thank all the guys who are responsible for the data and the IT management behind the scenes, and Dr. Shauna LeBlanc with LPSS for bringing these K through 12 teams here. So let's give everybody a round of applause. Okay, so just to dump some data on you. Today we've got 8 middle school teams and high school teams. We've got 8 college teams, 5 professional teams for a 21 team total. And of course, we have countless number of supporters. To add to that data, that's about 600 slices of pizza, and I've verified every single one of these. 600 slices of pizza, 250 cups of coffee, 50 of those were drank by CN and I, right? 150 energy drinks and about hundreds of lines of code. These lines of code were written to find potential solutions to a problem that is killing over 90 Americans every single day. The misuse and abuse of opioids. We call it the opioid crisis. I want to ask everyone to take a moment to bow their heads and remember any of those that you know that have been affected by the opioid crisis. Thank you. What you all are doing in this room is good work. It's good work, and I'm honored to be a part of it. Before I introduce our outstanding panel of judges, I'd like to tell you a little bit about myself. Again, my name is Reese Terrio. I'm an instructor of management and marketing here at the College of Business at UL Lafayette, where I teach courses that focus on sales and entrepreneurship and innovation. I'm also the executive director of Accelerate South, a healthcare-focused business accelerator program that will fire up in August. At the age of 18, I knew deep down in my soul that I wanted to be an entrepreneur, and I started channeling my creative energy into various projects while getting my undergraduate degree here at UL. I've tried my hand in food, in fashion, the arts, you name it, I've tried to do it. Once I started dabbling with data analytics, I partnered with one of my old professors here at UL, and we started doing some data analytics work. Being that I am a full-stack double ninja developer, I did all of the crunching myself. No, I'm a sales guy, so I was going out and basically selling and communicating the value of data analytics for my partner. And I started building a tech company as well. And that tech company has pivoted a lot over the years, but I started to find my passion was in that field, that analytical environment, this tech culture that you guys have created. So in pursuing those efforts, I began to grow close to some of the computer programmers throughout the Lafayette area, as well as the computer science faculty here at UL Lafayette. Outsiders may think that the people in this room are a bit different, but to me, you guys are my friends, you guys are my family, you guys are the rock stars of today's age. I really, truly think of you all in this room particularly, not only as rock stars, but as heroes, because you're all collaborating underneath a mission to help save lives and to help change lives for the better. Data is the resource that will pave the way to the future. Like all artists, you guys and gals are developing your craft, taking the resource of data, and building new technologies for the betterment of mankind, and I'm happy to and proud to be a part of it. So without further ado, let me introduce our panel of judges. Thank you. Thank you. So we have Ms. Kristen Lyman. Kristen has over 9 years of experience in health quality improvement, project management, regulatory compliance, and biomedical informatics. Kristen began her healthcare career as the manager of all accreditation, quality, and performance improvement efforts at Tulane Medical Center in New Orleans, Louisiana. No pressure for a first-time job, right? Since joining the Louisiana Public Health Institute, LPHI, in April of 2011, Kristen has been responsible for operations and regulatory compliance for 2 large grants. Thank you for being here, Kristen. We also have Dr. Bernice Chaudhry. Dr. Chaudhry is an assistant professor in the School of Computing and Informatics at UL Lafayette. Her research interests lie in the intersection of persuasive mobile computing, human-computer interaction, and health informatics. Let's give it up for Dr. Chaudhry. Next, we have Mr. Cian Robinson. Cian began his career at Lafayette General Foundation in August of 2014 as the Director of Development and Operations. In November of 2014, Cian was promoted to the position of Executive Director. In addition to his work at LGF, Cian is also an adjunct instructor at the B.I. Moody College of Business Administration at the University of Louisiana at Lafayette. I have the pleasure of working with Cian as the Executive Director of Accelerate South and in the college. So thanks for being here, Cian. Here with us as well is Dr. Alicia Guidry. She's a Health Information Technology Coordinator for the Informatics Research Institute at the University of Louisiana at Lafayette on a contract with the Louisiana Department of Health. She earned a BS in Computer Science from Louisiana State University and her PhD in Biomedical and Health Informatics from the University of Washington. Her doctoral thesis focused on data integration, knowledge representation, and global health. Thanks for being here. Peter Krogan, or Krogman as I've been calling him, is the Chief of Staff at the Louisiana Department of Health. LDH is the state's largest agency with a budget of $14 billion and 5,600 employees, encompassing the offices of public health, behavioral health, aging and adult services, developmental disabilities, and the Medicaid program. He works with the Secretary and other senior staff to coordinate policy development, quality improvement, communications, external affairs, and legislative affairs for the department. Thanks, Peter. We also have Dr. Lawrence Simon, who is with Blue Cross Blue Shield, Regional Medical Director. Thank you. So thank you for being here. So with that, I'd like to invite our first team up. As I'm doing that, I want to just make one quick announcement for each team that'll be coming and presenting. So in order to manage the time effectively, we've leveraged technology, obviously, because that's what we do, right? Especially me. So we've leveraged technology, and we've put up this little ticker on your left-hand side. This ticker will keep track of the time. It's a basic slide presentation that has different numbers. So at 5 minutes, you'll see a slide that says 5. It'll count down from 5 to 4 to 3 to 2 to 1. It'll give you a red marker that says you're 1 minute away from time, and then it'll give you a stop sign that says stop. Okay, now obviously you may not see that, so I'll be in the background saying, hey, stop. But it's right there to your left, so somebody try to keep track of that for the sake of time. After your presentation, you'll be given 1 minute for Q&A. So one of our fabulous judges will ask you a question, and you'll answer that to the best of your ability. Good luck. And then we'll move forward with the next team. Okay? So can we have, are we ready for team number 1? All right, so team 1 to the stand. Guys, let's give it up for the first team.
Hey y'all. We're not team number 1. Our team name is Team Riot, which stands for Related Issues About Opioid Tracking. And our project is titled The Riot Project. Okay. So this website is to provide a way for healthcare professionals, law enforcement, drug enforcement, social workers, and everyday citizens to determine where treatment and rehab facilities are currently located and where they are needed. This information is based off of the number of drug-related deaths per year per 100,000 people in each state and how many treatment facilities are already in the states. The Riot Project focuses on the treatment category. So the main focus of this website is to help government, both nationally and statewide, to determine where these treatment and rehab facilities need to be placed. And then this links to the data set that we use from the Cajun Code Fest website. While our current website focuses on data at the national level, the goal would be to expand it to as large or as small a place as you would like. So, for example, if a user wants to see the information at a state level rather than a national level, it'll be made available. The Riot Project's goal is to have information regarding the treatment and rehab facilities in relation to the opioid epidemic at the click of a button. Our goal would be to continually implement new data based on user feedback. And then the Riot Project would update often, giving users the information as it becomes available. This will keep the primary users current on information to better apply resources when the need arises.
Okay. Finding the web page. Okay. Come on. Okay. All right. So, going off of that, we have a map that is a ratio of the number of drug-related deaths per 100,000 people compared to the number of rehab facilities in each state, and the number is representing the facilities in each state. And so if you, not only that, but if you were to hover over each state, you would see the number of heroin addicts that would need to go to each facility evenly, and you can see that you could not fit 19,575 people in one facility. So the government could see this and say, well, should we plant a facility here? Or maybe there are other places where there needs to be more improvement on the programs in that state. So, and if funding would become a problem in that area, we have on the second page where you can, it has a list of the agencies willing to donate loans to the government that, I hate saying you can see right here, the Federal Domestic Assistance, they are literally saying, we are here to help. And it brings you to a link to their homepage, and you can get everything right there and be able to communicate with them, and they'll be able to assist from that point on. Not only that, but you could also see, you could choose a state right here, and we can go down to Louisiana and see that, that's not Louisiana. Well, anyways, the CDC funding of Maine is $1,198,000. So they receive this much money towards healthcare purposes. But the average amount of prescribers that they spend on opioid prescriptions yearly is 113,000. That's one person who's spending 113,000 on just prescriptions alone. And for our resources, we use these sites to help us make the map the functionality of it, and get all our information to keep it all together and be able to make it work the way it does, and actually also have our statistics of the I guess you would say the facilities, and how we actually got the information of the facilities and the number of deaths in each state. So, any questions?
Follow-up questions from our judges?
So would you say your primary users are?
Government officials, as of right now, since it's at the national level.
All right, let's give it up for team number one. All right, if I can have your attention, please, we'll get started with number two. Oh, this is officially. All right, guys, whenever y'all are ready.
Hello, this is the DTSMA Coding Crew Junior Team crew. Our names are Levi Abear, Blake Perry, Gabriel Miller, and Gabriel Insting. I will now hand this over to Blake Perry.
Hi, my name is Blake Perry. For the project today, we decided to do a graph that would show the amount of usage of opioids, where they were coming from, how to prevent it, and we created an app that could stop. We created an app that, a prototype app that we could use to help people that are using opioids or just need help generally with it. Some of the features that it has is it is able to, it has a tracking thing, application feature that could be used to say if you're near any hospitals or drug clinics to see if you need help, it could help you. There's also there is an emergency call part of it, where if you are overdosed on the drug, you can press it and it will call an ambulance to your location using the tracking feature. It also has, because it has the tracking feature, it will be able to see if you're too far away from, say, a drug clinic or a hospital, and it will give you a specific, it would ask you how you feel, how much of the drug have you taken recently, and it would give you a specific ingredient, like saying, I forgot what it was called. What's the Nexafloxine? Nexafloxine, which is a natural counteragent against opioids. So you could use it if you were in dire need and you were too far away from a hospital. Levi would like to talk about what some of the what President Barack Obama said in 2016 about it.
In 2016, President Barack Obama made a speech about prevention over opioids and said how he wanted to stop it because if it got overhand, it may become really popular in everywheres and lead to worse drugs like heroin and cocaine. Now I'll hand this over to Blake Perry for graphs on deaths in 2015.
So for the app, we decided to add in graphs. This is showing the so every every way of death has a specific code. Like the most common one, accidental poisoning by exposure to other unspecified drugs, medications, and biological substances, X44. It could be so if you go to the next graph, you could see the most common death, which is X44, right in front of X42, and then so on and so forth. And that's almost 65,000 deaths so far, and that's in the last, 2 years? Yeah, last 2 years. Next slide. So we did a predictive graph. So from 2016, from 2015, it was 3,300 deaths approximately. Then in 2016, it went up to 20,000 deaths. The next year, in 2017, it went up to 35,000, and then in 2018, it's already at 40,000. So in 2019, we expect it to be at least 50 to 55,000 deaths, and then 2020 could be 5,000, 10,000 more than that. So, okay, we're gonna head on to the application. This is opioid usage. The reddest part is where it's used the most. Say in places like West Virginia, 39.3 deaths. 39.3 deaths per day, and that's just insane. It's just showing the tracking app. Next part. No, click. This is an example of the tracking part. Next part. And this is like the emergency thing, how you feel whenever you're overdosed, and then the emergency button. Yeah. Would anyone, any questions? Yes? So you know how Google Maps has the tracking feature so they can see where you are to lead you to where you need to go? It's going to be similar to that, but it's going to have like places like hospitals and drug clinics highlighted. So say you were here and the nearest hospital is 10 miles away. It would tell you the direction there and how long to go and how long it should take, depending on what method of transport. Thank you.
Team 4 by Ella Smith, Ian Berza, and Isaac Lewis. Our focus: informing the public and officers of HHS. Deaths of Americans due to opioid overdoses. People overdose without noticing sometimes, but people also overdose to commit suicide. People do drugs for many reasons, like to run away from their feelings or they're being abused, so the drugs help stop the pain. But even though people do drugs for these reasons, they're still killing people and breaking families apart.
From 2011 to 2015, 148,462 people died from overdosing opioid drugs. To some, that is not a lot, but that is a ratio of 1 suicide for every 20 opioid overdoses.
In data graphs that we have examined, we have found 705 counties. In 2 years, 2014 and 15, we have seen a significant increase of deaths in opioids by 210% to 322.22%. Our counties on the right side have had a significant decrease of opioid drug deaths from negative 70.73% to negative 57.69%. My opinion, mayors of the right side should talk with mayors of the left side to help this problem with these other counties. Thank you.
The solutions. We want to make an app to check on how many times they fill their prescriptions, and every day they don't take any drugs, they can get a prize. Gift cards to restaurants and toys for their children. Teach the people about the life-threatening dangers of doing drugs and can lose your children and house. Limit the amount of opioids prescribed by doctors. On the app, it could tell you the things opioids have affected on you.
This graph shows, it's a heat graph, and the darkest spots are the highest crude rate, and the lightest spots are the lowest crude rate. This is in 2011. 2012, it's gotten a little worse. 2013, it stayed basically the same. 2014, it's gotten a little more worse. And in 2015, it is a lot more of the darker shade of blue. And this is the overall average crude rate. This shows the amount that it has changed. So in 2011, it was like between the 8 and the 9, about 8.5, and then 2012 it went to like 7.8, and then in 2013 it went to 7.9. Then in 2014 it went to like 8.2, and then in 2015 it has went to 9.1. Any questions?
Question, where, in terms of the app that you're developing, what would that be, a mobile app or a web-based app? Okay, excellent. Great, thank you so much.
I'm Dylan Martin. This is Stephanie Pham, Jacobo
Jacobo Espinosa.
Okay. Alex Lancloss. I said that right? Okay. We're Team 7. Our app is TOC, or the Opioid Crossroads.
How does this app help prevent? Well, we provide hotlines and forums. The forums are for people that they know someone who has overdosing addiction. So they would just look through the forms, and the hotlines are for people that they know they have addiction of drugs, so they will seek for help.
And then moving on from there are the signs and symptoms. This application on the app pulls up a list of signs that could lead to possible things such as drug addiction, and the symptoms are physical signs that the person is being involved with drug usage. If you catch these signs soon enough and call a hotline, you could possibly save your loved one from getting addicted to drugs and save a life.
The application was built on top of a React Native framework, so it allows us to get a hold of all of the different mobile market shares, both iOS and Android, plus utilizing that for Windows 10 devices, as well as, because of its modularity, be able to port this over to a website fairly easily.
How can your app be of use to the rural communities? It's quick and easy to access, and it shows a map of the addiction facilities in the area, all at the same time. Hotlines and forums in the app can also help the patients reach out to neighbors and professionals without having to meet face-to-face with anybody. What type of treatment does the app provide? Everything in the app leads to different types of treatment. The signs and symptoms can help, obviously, show the signs and symptoms. The hotlines, we discussed that one already. The intro questions or conversation starters would have you, it would show you how to approach someone who you would suspect of having an addiction to some kind of substance, any kind, and lead them to getting help.
You want to drive for me for the map? Okay. And this itself is actually an interactive Google Map display that has all the different facilities that are available around. And you can actually click into specific ones. It'll actually tell you the location, phone number, address. Specific facilities may service certain races, certain genders, may focus on specific cases of mental health, alcohol, drug abuse, etc. And so we do allow them to be able to look into that information. And if they have a website available, we do show that as well. And so one of the goals that we have with this application moving forward is to integrate like Google Places, the Google Places API, to have like hours information for the facility, to actually have like navigation to the facilities, etc.
Any questions from the judges? We're good on time.
So what were some of the data sources that you guys used to build this?
Yeah, so data source that we used in this case was actual treatment facility data that was provided from the Cajun Code Fest.
Who do you envision your users to be?
So our users could be anyone from a person who's actually suffering from an addiction to a loved one who could be a friend, family, whoever, who may think that someone may be suffering or know they may be suffering, and trying to find ways to
Give it up for Team 7. Up next, Team 8. Team 9, please make your way to the front.
Okay.
Hi guys, we're Team 8, we're the Otters, and our project's also called Otter, and it stands for Opioid Trend Tracking Respiratory. Okay.
So, opioids has always been a problem over the past couple of years, and so we did some research, and there are a total of 327 people living in America as of right now. And there are thousands of scripts being written out every day for these types of medications. 21 to 29% of these prescriptions are for pain medications, in which are mostly abused. 40,000 people, as of 2017, have died because of opioid use, and 346 people died in Louisiana. So we are trying to make sure that we can reduce these numbers, not just in our state, but also across the nation.
Okay. Otter's main objective is to predict the probability of becoming an addict for people who have been prescribed opioids, and also to prevent a relapse within opioid addicts already. In order to accomplish this, we've partnered up with 23andMe, which is a program that basically analyzes data of the patient's ancestors, and determines whether or not they contain their blood DNA contains a gene in which that can lead to them becoming opioid dependent. In order to predictive analytics such as these. Predictive analytics such as these can prompt the health provider as well as the patient to lead to immediate call to action.
So there was an article made by the National Center for Biotechnology Information. It was published in 2014, and it was called Genetics of Opioid Dependence. In this article, scientists found out that there were 3 genes that if you had them, you are very likely to end up as an opioid addict if you start on opioids. These genes were the DRD2 gene, the DRD3 allele, and the G allele. Using this information and 23andMe's API, Otter would be able to predict and determine the influences for opioid addiction, which means that if Otter knows that a certain addict or a patient has one of these genes, they would inform their doctor, and that way the doctor would make sure that that patient would not have any opioids. That therefore they would not have any sort of risk for addiction. And so for our innovation, our solution is not a common solution because we have a telepresent group therapy where we allow for patients and addicts and healthcare providers to interact together because it is progressive. You have to watch for the progress. You have to see if the people that you're treating are getting better or worse, and you have to monitor them. Our solution is not just a hotline, but it just provides for many things, which means you start out and you get your DNA test, and using that, Otter will be able to determine what kind of opioid addiction risks you have, and if there's anything you can use to treat, and what the doctors can help you with.
So basically how our website's basically set up is that where you go to your doctor and they notice that you have an addiction problem, they'll upload your medical record to the PMP, in which it allows you to create an account with 23andMe, and you get to see what genes you're having that are causing problems with your with drugs. And so this is a continuation of it going on to family trees, as well as communicating to other people across the nation to seek help, because there are just some reasons why you cannot reach out to medical facilities.
In order to make a profit, Otter works in conjunction with Medicaid treatments, as it's not the only treatment to help solve these type of things. It also suggests other treatments besides just opioids to patients.
And so the website that we made it to where there is a hot link at the bottom, which allows you to log in, and it leads to 23andMe. And with this, you basically sign in with your account. Can you hold this real quick? Thank you. Oh, well. Supposedly the password's not working, but in an ideal, perfect way, this would lead you to the website to where you can view the genes that you have that you would not be able to have access to medication due to particular reasons with that gene, as well as communicate with others.
There's a cost associated with 23andMe. How are you planning to combat that cost, especially since I think the majority of opioid abusers are coming from challenged situations?
Trying to work with the healthcare that they have, and we're trying to provide them with cheaper things, because we know that addicts, usually they are middle-aged people, but they don't have that good of income. And we are trying to lower the cost by doing this, because either way, it's supposed to prevent opioids, and either those people, they don't have the money to stop, so we need to help them by lowering the cost for this. And we're trying to work with all the health care that they have and the health insurance, and we're trying to see, like, for Medicaid, for example, we're trying to act with them and, like, just cooperate so that we don't have to make those people either not have the treatment that they need, or they have to pay for that much money.
Let's give it up for the Otters.
Hello, this is Team 9, the Info Freaks. You can thank this guy for that. Our project is called Objective Opioid Facts, or OOF. Anyway, moving on.
The main solution for our problem, our solution is to inform parents of teenagers and young adults as well as the general public of about the opioid epidemic in their respective areas. The way we plan on doing this is by informing them how to identify, prevent, and treat opioid addictions. The features of our app include nearby area heat maps of concentration of drugs in the area, or like drug-related deaths, popular street names for opioids, automatic-based and human-based chat support, weekly tips and updates on drug information, as well as settings to control basic app functions.
Our solution is mostly education-based. We tell the parents of the children how to find out and to know about the opioid epidemic, and the more they know, the more they can prevent their kid from becoming involved, or the more they can help their kid if they are involved. The app is sort of location-based, so even though it covers a large area, it can be very specific to you because it works around where you are, and it brings the information to you, and the more information you have, the better you are at preventing your kid from being affected. And the information is not only local, it's also current because the app is updated weekly.
Okay, so overall, we based our educational app on opioid risk advice, drug slang terminology, and support and updates. We also made this app friendly and effective, like user-friendly and effective. Thank you. Okay. So our app provides heat maps with real-time information on commonly abused drugs and opioid prescriptions in the area, so that you know what's going on around your area, so that you can keep your kids informed to stay away from certain things. We provide parents with a plethora of street names that are associated with certain drugs. so that if they hear these things, they can know, oh, that's bad, don't do that. We also have other things.
Our app combines a variety of constantly updated information and keeps the heat maps as well as any other information about opioids extremely updated with a easy-to-use interface. The app also has a feature that allows you to hold conversations with people that have dealt with opioid addictions in the past, and they can give you their insight on it. And it's a feature that not many apps have. We also plan on integrating a bot that can respond to the user's requests and provide reliable information.
Okay. Our app stays relevant through notifications on local drug activity, drug slaying databases, which I told you about, and software updates. It is important that parents have up-to-date information to protect their child in any way they can. We will ask to rely on federal and state government funding support to finish our app because we're not done with it. Having ad-free content is important because when our users are using our app, we don't want them to get frustrated or annoyed at certain things. This app was created to raise awareness for the problem of the opioid epidemic, because when you have a problem, the first thing you do is identify it and let people know. That's why we think our app would be a smart government investment towards the right cause.
It's a great job. And two-prong question. One, it seems like your target audience, if I understand correctly, is parents of high school children, whoever who may be exposed to this, and their parents may or may not know about it. Is that? And then is there any thought in your heat maps of including street value or cost data on it in terms of things that they might want to be keeping an eye on as well, or?
Cost and stuff with all that data so that you can keep informed on how much the drugs cost as well as how dangerous they are.
Let's give it up for the info freaks and their first hit single, Oof!
Hi, I'm Shakira. This is Noah. This is Jesse, Thomas, and Prachi. We're from Como High, and we created the application My Pills. Basically, what our app does is the patients have medication, they enter the medication to the app, and the prescriptions are classified as opioids according to FDA, and then they are added to our real-time tracker, which acts as a countdown as to when you can safely take your medicine. We also worked with the National Drug Code Directory that provides dosage amount, frequency, and information about the drugs. We also have a blog that contains alternative methods for pain relief instead of referring to painkillers, as well as a library of FDA-approved drugs. Next, we have a small demo of the app we created. Basically, we have a patient that was prescribed oxycodone. As you can see, the bar loads, and as the time decreases in intervals of an hour. Okay, let me just wait till that passes. Yeah. The patient hits the button that loads the time bar. When the bar decreases in intervals of an hour, once the bar has depleted, it is then safe to take another prescription without risking addiction.
So the theme for our app is to monitor the usage of oral medicines. Patients are notified whether their drugs are classified as opioids through our tracking system, and the app is directly connected to the National Drug Code Directory. And through this directory, we were able to pull lists of FDA drug names, active ingredients in the drugs, strength values of the ingredients, and whether or not the drugs are actually opioids.
For creativity, all of our app's functionalities are 1 to 2 taps away. Any drugs classified as opioids by the FDA are automatically added to the live tracker. We also have natural pain relief blogs, which shows ways to relieve pain without the use of drugs. There's also an FDA-approved drug library, which goes into detail about drugs you take.
For the user experience, what we use is the core product, which is the live tracker, which would read with an orange scale. That scale at a higher rate would mean that you're still in a higher chance of being in a chance of having a high overdose. And what you do is that once it reaches a lower level, what you would do is that you can then consume a pill, and then you can press the update button in the middle, and that will also include for the pill. As well, the pill also has a descriptive information where it also includes the side effects as well. In the bottom, you have the add new prescriptions, where you can include more prescriptions based on this with the database.
Sustainability. This app is very beneficial for people who want to be more cautious about prescription opioid usage. This app has the potential to standardize this the healthcare industry by requiring patients to have this app so that they can get their prescription. Typically, people have many doctors that prescribe different medicines, and usually these doctors don't talk. This is where the app comes in. Doctors, if allowed, can see patient medication usage, allowing them to better suit their prescription to the patient's current prescription. We also have a blog that focuses on the alternative pain relief and an FDA-approved drug library. Our focus is usage by targeting the at-risk population, which are people who are prescribed pain medication. This is a real crisis. With every passing hour, 7 Americans die. Our app provides an effective way to attack the root cause. Questions? I now open the floor for questioning.
questions from our panel? Good job, guys.
Yeah, take it.
We are team number 2, and we're the first college team. We are the programmers formerly known as Ben. We have a lot of Bens on our team. Right, so we were looking at the data sets, and we were overwhelmed by how much useful data that we were giving, and found it really kind of hard to interpret, so we decided to change this. We built a human-centered visualization portal of key indicators that makes it really easy to stay on top of the opioid crisis and to be informed. Because the more information that we have, the better that we can fight the opioid crisis. So we're saving time and effort of policymakers by providing one centralized location for all of the data that they would need to make any kind of decision. So, we're eliminating, for example, the need for, you want to look at local news. You have to go to one place for that. You can go to statistics. You might have to go to a dozen different places to get all of these things. So we wanted to make this very easy and provide one-stop shop for this. So we're displaying a multitude of data sets in an appealing and easy to understand way to make it better for humans, not just for algorithms. So we want to understand, and we did this through interactive maps and visualizations through graphs and prescription rates, doctor information, and then comparisons between some of these things. And we were inspired by popular services that make it easy to digest information and have a lot of it. We spend a lot of time in these things, so why not try and tailor this kind of model towards the opioid epidemic. So we did this, by doing this, we're providing a valuable service to not only local communities across the country, even rural communities that could be affected by this, but also to opioid policymakers especially. And our portal, lastly, we have a number of data sets now, but in the future this could be easily updated as data sets come out in the future, and also expanded as the needs of further data sets are identified. And so now, without further ado, Huang and Ben, one of the Bens, are going to show you what I'm talking about.
Hello guys, so my name is Huang, and I'm very happy to share with you guys about our hard work of 24 hours. So this is our application. When we go to our application, this is what you see, and this will be called a dashboard feature. We have a bunch of information about the general information about opioids and comprehensive, let's say about the active prescriptions and the fundraise. And then after that, below this, you can see the news. We will pull the news from News API to get the latest and the most popular news about opioid, and then we can educate people, the user, about what opioids is and what is the current status of opioid. Moving on to the next thing, this is one of my favorite features of our application, which I call doctor profile. In this doctor profile, we pull the data from more than 24 million data points, and then arrange them in a way that people can see and in a friendly way. So we group the doctor by numbers in every city, and you can when you hover the mouse over the data point, you can see the information around that city, like the number of doctors and the number of cases that they have to deal with. When so they zoom in to see like more cities when they close to each other. Another feature of the doctor profile is the ability to search for doctors in your based on state, cities, and you also can limit the range of how many results you want to receive. So, and then when you click on the doctors, you can see their personal information appear in this dashboard right here. And that is one. And moving on, I want to let Ben introduce the rest.
Sure, thanks. Hi, my name is Ben. Hope you don't mind if Rin handles this map for me. So we also include some visualization tools that use, I think it's Google Maps API, but they create heat maps. And in addition to comparing by year, we also can toggle graph type to select cities, toggle graph type, quick. And let's try, like, I don't know, Connecticut. or Arizona, Connecticut, works for me. And compare the differences between, this is opioid cases, so this is legal. And besides that, we also have, what's the next thing? We're out of time? Time. All right. And we also have number of opioid treatments versus prescriptions as a bar graph. But this is really extendable, modifiable, and powerful. And I don't know, I think it's useful. Thanks.
From our judges, any questions? Excuse me. I'm sorry. Go ahead.
So with the doctor profile, am I just going to be able to see one prescription or all of their opioid-related prescriptions?
So right now, this data we pull from like all the prescriptions, but however, it's very easy and it's very extensible for us to modify the code to provide the doctors that only provide the prescription about opioid. So as you can see right here, we can easily like sort the doctor by city and state. So I choose Illinois, but there's no city named Lafayette, Illinois, so there's no results return. But when you remove the city, you can see like a list of doctors, and then you can like get more results about the doctors by increase the results. So it's like I put like 100 doctors, and it's gonna automatically update all the doctors for us. So ask your questions. It's just like it's really extensible for us to add the option to choose the opioid prescriptions to our system, and I think it's one of the very interesting features that we need to develop in our app in the future. Thank you. Is there any other questions?
Hello. Hello. So that's an augmented reality-based virtual agent, which I was kind of hoping for it to do the presentation for me, but hardware connectivity issues, we couldn't let it do the presentation. So going over, overall, we are developing an augmented reality-based intelligent system. So when I say intelligent, it has artificial intelligence features too, which we didn't implement it, but that's the future goal of the project. So it's an augmented reality based, it's a continuous care system where the care doesn't necessarily has to stop once the patient leaves the doctor's office with a prescription. So the patients will be given an augmented reality glasses where they can take with them, and then they interact with this agent every now and then. And when it comes to the risk assessment system, or we developed a risk assessment system using the data we have, so that is kind of, we award a risk score to each patient based on their demographic profile, like their age, sex, race, ethnicity, based on their income group, based on their mental health conditions, and based on their prescription medical history. So we developed a weighted risk score assessment. And when I say prescription, patient prescription history, that is a recency-based model where the time frame of 2 years is being broken down into 2 months, and then we first get a pattern in the period of two years, and if we see an increase, the patient will get a high risk score, and if we see a decrease in the opioid use or pain medication use, the doctor would see a low risk score for the patient. And it's an ensemble-based modeling, and that's a snapshot of a risk score for 2 people that was developed using Power BI. And the patient's profile will be accessed by the healthcare providers and the doctors. So doctors can make important decisions. And the augmented reality system, the end system, it's the patients are the users for that, and it qualifies under public health surveillance category. So coming to the challenge, preventing opioid abuse or drug abuse, the doctors, once they see the risk score of the patient, which is interactively, which they can make some modifications to it, they can interact with it. Once they see the risk score, if it's a high risk score, then they can take a decision of whether to admit the patient or make him an inpatient until he's done with his pain medication or until he's done with treatment of the opioids, or whether to restrict his dosage or the number of pills he's going to get from a single prescription. And once the prevention is taken care of, then comes the treatment part where the augmented reality system kicks in. It updates the patient profile. It constantly interacts with the patient like every 4 hours. The doctors can mandate it. Every 4 hours you have to interact with it, or every 6 hours you have to interact with it. And it keeps updating the patient profile using natural language processing. So this can be done for multiple patients in the same day, whereas if a human is doing it, they have to call, physically call, talk to the patients, take notes of what the patient said, and it is a sequential process. But this thing, it's virtual, so everybody anywhere can access it, and so multiple patients can take advantage of this system. And once the system does the treatment, or once it updates, it can do analysis and alert local authorities, stakeholders, friends, family, everybody to say that if it recognizes a pattern in abuse or addiction, it can alert. And coming to the rural context, it's fairly tough to build hospitals, rehab centers, healthcare facilities in rural areas, but it's relatively simple to bring a particular rural area onto the internet, have them internet, and this needs just internet to communicate with the hospitals and the emergency services. So innovation, we created an ensemble data model, the one that assesses the risk, and then we are using the augmented reality for continuous post-care, customized feedback and games the user can play to overcome their pain, divert the user from the pain, overcome their social anxiety, overcome depression, and make their homes and lives better. So these are the intended users, patients, doctors, and coming to sustainability, we have a father of a young, talented musician, a smart man who passed away, unfortunately, last year because of opioid abuse. So if this system can continuously collect data from that user, interact with them, and then alert the doctors, family members, friends with personalized treatments and games and social VR, so he could have overcome his social anxiety, and the system detects a pattern of going towards the drug abuse and then finally addiction, so it could have sent alerts to save a human life. So that's the real value of it, and once people start seeing the real value of it, it is a sustainable model. Social VR, games, virtual reality, artificial intelligence, that's the future. So these are a few data sets that these two people have used. These are my data scientists. Any questions?
All right, let's give it up.
Hello, we are Team 13, or Team Async, and our solution is called Blue Sky. We decided to focus on treatment as well as prevention, and to do so we created Blue Sky as a platform for support for people addicted to opiates or concerned friends or family that may want to take that initiative for them to help them with their treatment or through a tough time. The use for this application would be not only to provide support, but as well as a wealth of knowledge in one central location for people to be able to assist themselves or someone else through an opioid addiction. And by doing so, it would help create a strong community in our application where multiple people can come together and help each other through similar experiences that they may be able to share together and offer advice and support. And one other thing that would make it helpful is the anonymity of it. Since it's online, you can choose whether or not you want to identify yourself or not, which some people may feel more comfortable doing so rather than an in-person type meeting. And it would be very easy to use since our application is a mobile application rather than having to wait and go to a meeting or go to a public place. It's right here, right now, whenever you need the support, right in your hands. So what differentiates us from something else like a public forum like Reddit? So the reason is Reddit or other forums are much more broad, they're wider, they have a larger scale of things. But when you talk about our application, it's solely for the prevention and treatment. And when you have more people that are focused on one type of deal, you're going to have a much better experience with a concentrated area rather than a much more broader topic of certain things. And since it's all in one location, you have all the information exactly where you need it, right when you need it. You don't have to go searching multiple places and trying to figure out certain things. It's all in one location, and it's much quicker and easier to use. And it'd also be very good because our application will be trustful, because down the line we could potentially have hired professionals on our website as well that could be able to offer support in addition to other individuals who may have been in similar situations. And one other thing is that in our application we could have a type of review process for certain treatment facilities where people could share that they had a certain good experience in a certain location, and that may be useful to certain people. And for the future of our project, we would sustain it by having donations and potentially advertisements. That way there's hopefully no cost to any of the users that need the treatment. And as the community grows, gets larger, it'll become more beneficial to everyone as there are more people available to help at all times. And then we will have a quick little demo of our application, and here are a few screens from our application, and we will get into that right now. Cool, so now you can see our simulated Android application where you would go in and log in as your username and sign into our application. And we appear to be having some difficulties, so I'll just talk about it. So over on the left here is using Google Maps API to get our location where we are on the right, as well as the nearest treatment centers in the vicinity, so people can load it up and have that access for the information there, as well as the discussion on the side, which would be like an open forum for people to talk, as well as private messages where you want maybe a more one-on-one experience with someone to have, and as well as a data chart that we had that we can't see at the moment, but would show potential deaths related to opioids at certain states and locations. Yeah, we're done. Thank you. Any questions?
Nice work, and no worries about the technical difficulties. What do you think will draw people in to use this app and join this community?
I think one of the main things that if we could have had this data set here, what we would like to do initially to grow the application is go to places that have a high density of opioid problems, which this type of application may be more appealing to those type of people. And if we get a certain place like that to kind of take it off the ground and go forth with there, and it would be able to help those type of people, hopefully by having good personal connections as well as the sense of anonymity if certain people choose to do so. Thank you.